my name is Kelly. Today we are talking about type 2 diabetes. My client is Nathan. He's 28 years old. He currently lives with his mum and he is unemployed. He's had type 2 diabetes for the last 12 months. He also has schizophrenia. His current weight is 168 kilograms. His lifestyle is sedentary, very little exercise, apart from a couple of short walks each week. His diet is also poor. No family history of diabetes or heart disease. There is a family history of depression. He smokes 10 to 15 cigarettes per day. He doesn't drink any alcohol. Current medication, metformin for his diabetes. He's also on antipsychotic medication for his schizophrenia. The role of insulin is very important in managing our blood glucose levels. So, as we can see, in a non-diabetic person, when blood glucose levels are raised, insulin is released by the pancreas, the beta cells in particular. The insulin then, with the help of transporters, moves the glucose from the blood vessels to the liver for storage until it's ready to use by the target cells, thus keeping blood glucose levels within normal range. However, in someone with type 2 diabetes, the insulin is being produced, but it's not working very well. It's not doing its job properly, and this is called insulin resistance. And then because the blood glucose levels are remaining high, the pancreas works overtime to produce more insulin. Eventually, this can wear out the beta cells, can lead to cell destruction, and eventually insulin can cease to be produced. As we can see here, when insulin can't move the glucose out of the blood vessels, the glucose remains high in the blood vessels, causing problems which we will now talk about. A number of effects of poorly controlled blood glucose levels. One of them is retinopathy, which is where the blood vessels of the retina become damaged over time. This is a major leading cause of blindness and a common side effect of people with diabetes. This happens from increased pressure within the cells caused by water rushing in. The cells swell, they become blocked, they can burst, and this leads to internal bleeding and inflammation in the retina, as we can see in the picture here. Another problem that can happen from poorly controlled blood glucose levels is angina, which is chest pain caused by reduced blood supply to the heart. As we can see here, this can occur because of fat buildup in the arteries. When there's lots of glucose in the blood vessels over time, they can damage the endothelial lining, and this allows bad fats, the LDLs, to build up in the artery, causing blockages here. As we talked about before, Nathan's weight is a significant issue. He's 168 kilograms. He carries a lot of that weight around his abdomen, and this is a major risk factor with people in diabetes, and there's a close correlation between insulin resistance and persons with increased abdominal fat. This seems to be a correlation due to high levels of free fatty acids, which can prevent target cells from responding to insulin. Also, it's been researched that fat cells can disrupt the normal functioning of a number of hormones such as leptin, which have a close relationship in our response to insulin. As we said before, Nathan's on metformin, a common treatment for diabetes. How does this work? It works to try and inhibit glucose production, glucose release from the liver, and working to oppose glucagon action. Thus, we hope that metformin is going to reduce our blood glucose levels and can also work to reduce our weight, thus giving our better chance to make the insulin do a better job, making us more sensitive. The HbA1c test, very important measure of long-term blood glucose levels because it captures the amount of glucose attached to hemoglobin in our red blood cells over a long period of time, which is important because our red blood cells can live up to 120 days, so we need to capture the levels over time. And the better chance that we have a measure of long blood glucose levels, then we can adapt our medication, diet, to help people manage their diabetes better and reduce the risks of long-term problems. Thank you for listening. Here is my bibliography, the references that I use for this presentation.